This bill just cuts federal funding for Planned Parenthood for 1 year. What does that do for you?
It concerns me.
Will you vote for something that does that cuts it at all?
You know, what I have said very clearly is that I don't think that the issue of Medicaid reimbursement for Planned Parenthood should be an issue in this bill. If we have to get to a point to offer amendments, I would move to strike that.
Joining us on set, the president of Planned Parenthood, Cecile Richards. Cecile, Mike Pence, we played a soundbite from him last week.
Right.
You still have Planned Parenthood in the, definitely they're going for trying to take it away, the funding. So tell us what your biggest concerns are moving forward, especially now that this bill is on hold, or at least a failure for now.
Right. Well, it was great to see Senator Murkowski, Senator Collins. They've been very, very clear that ending access to Planned Parenthood is sort of a deal breaker. And it's really important to understand, as Senator Murkowski says, we're not in the federal budget. That's a real misnomer. So there's no defunding. Actually, what it is that we get reimbursed just like hospitals and other healthcare providers for providing preventive health services. And in a state like Alaska or Maine, I mean, frankly, all over the country, women need access to affordable health care, and that's really what Planned Parenthood represents.
Casey Hunt in Washington has a question for you, Cecile.
Hey, Casey.
Sure. I want to dig into this a little bit because I think you've hit on something, which is viewers and people sometimes ask me the question, what does defunding Planned Parenthood actually mean in a day-to-day? So if you have a Planned Parenthood clinic, say in a rural place, and this bill were to go through as it's written now, what happens? Does it simply become financially unsustainable? Do you have to turn, say, people on Medicaid away? What is the practical impact of this?
Sure. Thanks, Casey. And look, I'll give you a perfect example. I was just in Paul Ryan's district where we have 3 Planned Parenthood health centers. They provide only preventive health services, cancer screenings, birth control. For many women, we're their only health care provider. And what it would mean is all of the women on Medicaid in that district could no longer come to their health care provider, which is Planned Parenthood, and get their basic access to care. One of the things that I think that is kind of lost on a number of members of Congress is, you know, half of our health centers are in medically underserved communities. That means a lot of rural, small town, Midwest communities, and we've been hearing from women. 1 in 5 women in this country go to Planned Parenthood for health care at some point in their lifetime. We've been hearing from women who are absolutely panicked about where they can go to for care. And I think the other thing that's important is, you know, we're so proud of the work we've done on preventing unintended pregnancy. We're actually now at a historic low for teen pregnancy in the United States of America. We're actually at the lowest rate of abortion since Roe versus Wade was decided. And one thing that hasn't been reported too much out of the CBO score is that they estimate, and as does every other medical journal, that if you actually block access to Planned Parenthood, unintended pregnancy will go up, as will the rate of abortion, which just seems crazy to us.
So,
Mike.
Cecile, it's apparent that the Republican Party has had an obsession for 7-8 years now with Obamacare. From your point of view, though, what is their apparent obsession with Planned Parenthood?
I think it's a great question. I mean, one of the problems we have, of course, is this bill was drafted with only men. I think it's notable that the 2 most vocal Republican opponents are women. They understand fundamentally that for women, this is not a political issue. This is an issue of access to affordable health care. I can tell you, we have, last year, I believe, we did more than 300,000 breast cancer screenings. We detected more than 70,000 cancers for women who live in a community where there's no other provider. And even though the Republicans say, well, they can go anywhere. Well, if you have a lump in your breast, you can't wait 1 or 2 months to actually go see a doctor. That's what Planned Parenthood represents. And I just think the Republicans are making a big mistake by putting politics ahead of women's health care.
It has to be encouraging on one level to have one of the most vocal and passionate defenders of this of this issue be Lisa Murkowski.
Absolutely.
I mean, when I was in Congress and Joe was there, it was generally Democrats that had to make the case. But for Lisa Murkowski to make the case, how significant is that for Planned Parenthood, and how significant is that for big health conversations going forward in your estimation with the Senate?
Well, it's huge, Harold, and I think one of the reasons that Lisa is or Senator Murkowski is such an advocate is because we provide health care to thousands of women in Alaska, and she and I have spoken many times. She said, you know, if you're in Juneau or you're another small town in Alaska, Planned Parenthood may be the only place open to get family planning services, to get your breast cancer screening, your cervical cancer screenings. And I just feel like we can, I mean, I think this is where you're hearing why women are so upset about this bill.
Right.
It actually takes away access to health care when in fact we should be increasing it. And I think women just feel like, boy, if members of Congress can choose where they go to for health care, why shouldn't women in America be able to choose Planned Parenthood?
Just in Juneau or in places like that, are there places where Planned Parenthood is the only option?
Oh,
There's
absolutely.
no other options around. You could show on a map.
Absolutely. You can look at, again, that's what I saw in Racine, Wisconsin, in Paul Ryan's own district. There was no other safety net provider for family planning. And again, I mean, the main reason you can prevent unintended pregnancy is because women can get in and get birth control when they need it, and they can get the best kind of birth control. That's what we provide at Planned Parenthood.
Donald Trump's position on Planned Parenthood has been sort of strange over time. If you look back at the debate in February of 2016, he said, quote, millions, this is in a Republican debate, millions and millions of women, cervical cancer, breast cancer, are helped by Planned Parenthood.
That's right.
I would defund it because I'm pro-life, but millions of women are helped by Planned Parenthood. He took some heat for taking the side of Planned Parenthood. He said more recently that if you stop performing abortions at Planned Parenthood, you could keep all your federal funding. Is that something you ever would consider?
No, I think it's really important, Willie. And I appreciate the fact that you said and recognize what I think most people in America recognize. In fact, 80% in the latest poll that Planned Parenthood provides vital health care for millions of women in this country.
And Donald Trump recognizes that.
Exactly. And that's because it's true. I mean, 1 in 5 women in this country have been to us for health care. It's just a fact of the matter. And the thing I don't really understand, and I would challenge any member of the United States Senate or Congress, is if you really want to reduce the unintended pregnancy rate and the need for abortion, you should be funding groups like Planned Parenthood that actually every single day do more than all this political wrangling do to provide women basic access to health care, detect cancer early, give birth control to folks who need it to prevent an unintended
That proposition from the White House is a non-starter. Stop performing abortions and you'll keep your money.
It doesn't make any sense. It's a legal right that women have. And what I'd say, Willie, is important. We operate just like every hospital in America. We operate like other community health centers that provide abortions as well. But we do more in the area of family planning than any organization in this country.
Cecile Richards, thank you very much. Good to have you on the set with us. Still ahead, Senator Dick Durbin was heard singing the Rolling Stones. You can't always get what you want after Republicans postpone the vote. But will Democrats be able to get what they want? The Senate Minority Whip will join us. Plus,
thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.